He needed a titanium rod. He got a screwdriver. A 73-year-old man wakes up in a hospital bed in Hilo, Hawaii. His name is Arturo Iturralde. He is groggy, he is thirsty, but mostly he is relieved. He believes the surgery is over. He believes the titanium rods inside his back are finally going to stop his pain. He is wrong. If you could look inside Arturo's back right now, you wouldn't see medical hardware. You would see something that belongs in a maintenance kit. Jammed into his spine is the handle of a stainless steel screwdriver. It is sawed off, it is jagged, and it is sitting dangerously close to the nerves that control his legs. This wasn't an accident. It wasn't a tool left behind by mistake. This was a choice. While Arturo was asleep, his surgeon made a decision that defies all logic. He decided that a screwdriver was good enough. He decided that waiting 90 minutes for the right part was too long. This is the story of a man who trusted a hospital with his life. It is the story of a surgeon with a dark secret, and it is the story of the oops that turned a routine surgery into a crime scene. To understand this nightmare, we first need to look at the victim. Arturo Iturralde was a good man. He was a 73-year-old Baptist minister. He had spent his life helping others. But in his final years, Arturo was fighting a losing battle against his own body. He had a condition called degenerative spondylolisthesis. That is a big medical word, but the concept is terrifyingly simple. Think of your spine like a stack of building blocks. In a healthy back, those blocks are perfectly aligned. They protect the spinal cord. But in Arturo's back, one of those blocks had slipped forward. It was sliding off the one below it. This slipping bone was crushing his nerves like a vice. Every time he stood up, gravity made it worse. The pain was electric. It shot down his legs. It made walking nearly impossible. There was only one way to fix it. Arturo needed a spinal fusion. The goal is to build a bridge between the slipping bones. Surgeons use metal rods to grab the vertebrae. They lock them in place. Once locked, the bones can't slip. The nerves can finally breathe. But you can't just use any metal for this. You have to use titanium. Titanium is special. It is strong, but it has a little bit of give. It can flex slightly with the human body. If you use a metal that is too stiff, it will snap. Arturo didn't know the engineering details. He just knew that he trusted Hilo Medical Center, and he trusted his surgeon, Dr. Robert Ricketson. That was his first mistake. Dr. Ricketson shouldn't have been operating on anyone. Before he landed in Hawaii, Ricketson had left a trail of disaster. In Oklahoma, his medical license had been suspended. In Texas, it had been revoked entirely. His file read like a horror story. There were reports of botched surgeries, there were allegations of gross negligence, and most disturbing of all, there was a history of drug addiction. Ricketson had been accused of performing surgery while high on narcotics. He was what the industry calls a danger doc. So how did he end up in charge of Arturo's spine? This brings us to the dark side of the medical business. Hospitals are businesses. An empty operating room is a financial loss. Hilo Medical Center had a vacancy. They needed someone to fill it. They saw Ricketson's application. They saw the red flags from Texas and Oklahoma, but they hired him anyway. They committed negligent credentialing. Basically, they chose profit over safety. They handed a scalpel to a man they knew was unstable. On the morning of January 29, 2001, the hospital made one more mistake. They failed to check their inventory. As Arturo was wheeled into the operating room, the titanium rods were missing. They weren't even in the building, and the man waiting for him was not the kind of doctor who follows the rules. The morning of January 29th started efficiently. Arturo was placed under general anesthesia. Dr. Ricketson opened his lower back. He carefully exposed the lumbar vertebrae. He cleared away the bone spurs. Everything was going according to plan, until the 2-hour mark. That was when the surgical technician reached for the implant kit. It was empty. The titanium rods were missing. They had been left out of the inventory. Panic rippled through the operating room. A staff member scrambled to call the supplier. They got an answer. The rods could be rushed to the hospital by courier. It would take 90 minutes. This is a hiccup. It is not a catastrophe. Standard protocol is simple. You keep the patient stable. You maintain the sterile field. You wait. But Dr. Ricketson didn't look at the patient. He looked at the clock. He became agitated. He refused to wait. He claimed Arturo had been under anesthesia too long. This was medically debatable, but Ricketson wasn't debating. He scanned the instrument tray. His eyes landed on a medical-grade screwdriver. This tool is designed for one thing: torque. It is used to tighten screws, then put back on the tray. It is made of solid, hardened stainless steel. It is not an implant. But Ricketson reached for it anyway. The room went silent. He called for a surgical hacksaw. He gripped the stainless steel handle. He began to saw through the metal shaft. This wasn't easy. Hardened steel is resistant to cutting. It took physical force. It generated heat. Metal shavings fell onto the sterile drapes. The staff couldn't believe what they were seeing. They broke the hierarchy of the operating room. They spoke up. One nurse explicitly told him to stop. "That is not an implant," she said. Another technician warned him about the metal grade. Ricketson ignored them all. He finally snapped the shaft free. He held up the jagged, sawed-off piece of steel. It was roughly the same length as the missing rod. To him, that was close enough. He placed the scrap metal into Arturo's spine. He hammered it into position. He tightened the brackets around it. Then he closed the incision. He stripped off his gloves. He had saved 90 minutes of his time, but he had just planted a time bomb in Arturo's back. Arturo Iturralde woke up in recovery. He felt the haze of anesthesia lifting. He felt a dull ache in his back. To him, this was a bit sign. It meant the surgery was done. He told his family he felt hopeful. He thought the years of electric pain were over. He had no idea what was actually inside him. He didn't know his spine was being held together by a piece of scrap metal. And this brings us to the physics of the disaster. Titanium rods are engineered with a specific modulus of elasticity. That means they are strong, but they are also flexible. When you walk, your spine bends slightly. Titanium bends with it. It shares the load with the bone. But the shaft of a screwdriver is different. It is made of hardened stainless steel. It is designed to be rigid. It is designed to resist torque. It does not bend. It fights back. So every time Arturo moved, a war was happening inside his back. His spine wanted to flex. The screwdriver wanted to stay rigid. The metal began to fatigue immediately. Within 48 hours, the improvisation was already failing. Arturo tried to shift his weight in bed. During his recovery, Arturo suffered a fall. For Arturo, it was the end. 3 days after the fall, he felt it. A sharp, sickening snap. Deep inside his lumbar region, the screwdriver shaft had shattered. It broke under the weight of his own body. The jagged ends of the steel were now loose. They were grinding against his vertebrae. They were slicing into the surrounding tissue. Arturo screamed. The pain was far worse than before. An emergency X-ray revealed the horror. The hardware had snapped in two. Dr. Ricketson was called back to handle the crisis. On February 5th, Arturo was wheeled back into operating room 3. He was once again under the knife of the man who ruined him. This time, the titanium rods were there. Ricketson opened the incision. He found the shattered pieces of his improvisation. He removed the steel shards. He finally installed the rods that should have been there all along. Then the cleanup began. The broken pieces of the screwdriver were discarded. They were thrown into the biohazard trash bin like common waste. But a nurse named Janelle Feldmeyer was watching. She knew this wasn't just medical waste. She knew it was a crime scene. She reached into the bin. She fished out the broken steel. She sealed it in a bag. The hospital thought the problem was buried. But thanks to Janelle, it was now Exhibit A. The second surgery was technically a success. The titanium rods were installed. The spine was stabilized. But for Arturo, the nightmare wasn't over. The trauma to his spinal column was cumulative. It was the result of 2 surgeries in 1 week. It was the result of jagged steel grinding against bone. In the weeks following the second operation, his condition deteriorated. He didn't just bounce back. The nerve damage progressed. Arturo Iturralde, a man who stood at a pulpit his whole life, lost his mobility. He was eventually confined to a wheelchair. He was trapped in a cycle of chronic pain. His body began to shut down. He suffered from urinary tract infections. He suffered from dangerous blood pressure spikes. He lived in agony for 2 more years. In June of 2003, Arturo passed away. He died without ever receiving an apology. He died without seeing justice. But his family refused to let it go. They filed a wrongful death lawsuit. And this is where the story gets even stranger. Dr. Robert Ricketson was facing a massive lawsuit. He was facing the end of his career. Most doctors would hire a team of high-powered defense attorneys. Ricketson didn't. He made a shocking choice. He decided to represent himself. In legal terms, this is called pro se. In practical terms, it is suicide, but it fits the profile of a narcissist. The The same ego that told him he could improvise surgery told him he could outsmart a jury. The trial was a spectacle. Ricketson stood before the court. He didn't deny using the screwdriver. Instead, he tried to justify it. He called it a judgment call. He argued that he was the victim. He blamed the nurses for the inventory error. He blamed the hospital for not having the rods. He claimed he acted in the patient's best interest. He used complex medical jargon to confuse the jury. He tried to make the improvisation sound like a heroic split-second decision. It might have worked, until the family's attorneys played their trump card. They didn't need jargon. They brought out the evidence bag. They held it up for the jury to see. Inside was the actual handle of the screwdriver. It was solid stainless steel. It was sawed off. It looked cold. It looked industrial. The jury looked at the tool. Then they looked at Ricketson. The illusion of the heroic surgeon collapsed instantly. You can argue about medical necessity. You can argue about standard of care, but you cannot explain away a hardware tool in a human spine. The jury in Hawaii deliberated. Their decision was absolute. They were not moved by Ricketson's claims of heroism. In 2006, they returned a verdict that shook the medical community. They awarded the Iturralde family $5.6 million. But the money wasn't the most important part. The jury sent a message to the hospital. Hilo Medical Center was found 35% liable. It means the hospital failed to do its homework. They knew Ricketson was a danger doc. They knew he had been chased out of Texas and Oklahoma. They invited a known risk into their operating room, and Arturo paid the price. As for Dr. Ricketson, the screwdriver scandal was the end. His license was revoked permanently. He was stripped of the right to practice medicine. He would never hold a scalpel again. Today, Arturo's story is taught in law schools. It is a case study in medical ethics. It is a grim warning about the dangers of ego. In the high-stakes world of surgery, there are no shortcuts. There is no room for improvisation, and there is no place for a screwdriver. Arturo Iturralde's life was cut short because a surgeon couldn't wait 90 minutes. But thanks to a nurse who reached into the trash, the truth wasn't buried with him. The evidence remained, and it proved one simple, terrifying fact. When you go under the knife, you are trusting a stranger with your life. You better hope they brought the right tools.